Yeah, I'm glad to present to you with three case study. In my note, I have here as a first case study a 25-year-old woman with a history of sickle cell disease presented to our clinic for follow-up after hospitalization of vaso-exclusive pain crisis complicated by influenza A. She has a history of acute ischemic stroke at age 5 and has received monthly simple red cell transfusion since the stroke, and the last transfusion was approximately 4 months prior. She is taking deferoxazine 20 milligram daily, but occasionally she missed doses. So she was diagnosed of a sickle cell disease, then iron overload due to a long-term transfusion, uh, and she missed doses by the escapades the issue. She was also diagnosed of a viral infection, that is the influenza, and there is also the risk of a recurring stroke because except she's closely monitored, then the transfusion is done frequently. Then the treatment plan includes regular transfusion since the patient has a history of ischemic stroke and receive monthly red cell transfusion. Then we also have here as a hydration. This needs to be encouraged to reduce the risk of a vaso-exclusive crisis. We also have here as pain control to ensure adequate management of pains during these acute sickle cell crisis. Then she also has to be taking a vaccination to reduce the higher risk of these diseases. Then we also have here as a chronic transfusion therapy. Then we have here as a second case study, Brother James, can you read the second case study?
A 51-year-old man, a 51-year-old Japanese man ate reheated rice with stew meat from a Kenyan restaurant, and developed abdominal cramps, fever, diarrhea, dizziness, and loss of appetite. He was treated with Prohabit and ciprofloxacin and recovered after 3 days. Diagnosis: Amity type, causing vomiting which is typically linked to rice and certain starchy foods. Bacillus cereus, food poisoning. Diarrhea type, treatment plan, ciprofloxacin and antibiotic. Hydro, hydration and electrolyte replacement. Oral hydration and rehydration solution, ORS.
Okay, thank you. So that is the second case study. And in the third case study here, we have a 20-year-old man with a social phobia disorder who experienced a difficulty in concentrating on interaction, stuffing, then a sweating and replaying conversation. He also isolated himself, turned down invitation and ignored his phones and skipped classes. So he was diagnosed of social anxiety disorder, make fear or anxiety about social situation. Then the social situation almost always provoke anxiety, which may manifest as a physical symptoms. So um, she was also diagnosed of avoiding the behavior often presented, such as avoiding social interaction. Then the treatment plan include lifestyle modification, now regular physical activities, then sleeping hygiene, balanced nutrition, then social support and peer interaction. We know that family and peer support involve supporting friends and family members in the treatment process, and then social encouragement can improve the inherent treatment. So in this kind of condition, the sick person has to uh, uh, interact frequently, play with friends, increase the balanced diet, and regular exercises. I think that will help reduce this kind of disease. Thank you.